For her analysis now on the Greater Sydney lockdown, I want to bring in an expert, infectious diseases physician, Professor Emma McBryde. She joins me now from Townsville. Professor McBryde, thank you for your time. Some are now saying that Gladys Berejiklian's announcement of this stricter lockdown this afternoon, in effect at 5 o'clock, has come too late, 2 weeks too late. You're an expert. What do you make of the decision today? Should these restrictions have come in earlier?
Well, it's easy in retrospect, isn't it? I think 2 weeks ago they would have been more effective, faster. And of course, it's a very hard call. You don't want to lock down really too early. And I think New South Wales Public Health have done extremely well at avoiding lockdowns, but I think they've lost it this time. So yes, of course, it would have been better if this had happened 2 weeks ago. Having said that, a lot of it is because people are not doing what they're told to do rather than not being told to do the correct things at the moment.
Well, that's a good point. I mean, how much of this is Delta being a particularly tough, virulent strain, and how much is it people not abiding by the initial, I have to say, softer lockdown?
Yeah, I think it's a bit of both. So what we've seen, and I know exactly what you know, there's been people who have not taken notice of the requirements and have had birthday parties and other things. I think Sydney-siders, understandably, were a bit complacent because they have done so well so far, and that, you know, the excellent public health management was enough to get them through. But with the Delta strain, it's not enough, and they just have to really. I think it's appropriate that they lock down harder now, because we really are on the brink of a solution around the corner. Not 100%, but a really good solution with the vaccine on its way.
Yeah, just on that point, National Cabinet announcement already in the media, but reinforced at National Cabinet today that we've got these Pfizer jabs due in October. Millions of jabs being brought forward. Will go from about 300,000 Pfizer vaccination available per week up to about 1 million. How critical is that going to be in terms of turning the tide on where we are now in this rolling series of lockdowns?
Yeah, it's been so frustrating up to now. So this is such a welcome bit of news. And we can now sort of move from wondering why no one's even campaigning to get people vaccinated because we don't have the supply, to now really mobilising the support and the groundswell of desire to get people out and vaccinated. So I think it's a crucial turning point.
I've been saying on the show, and certainly anecdotal, I'm in the age cohort that was affected with the earlier rules, 50. But there's so many people I talk to that are absolutely desperate to have vaccination, but they're concerned still about AstraZeneca. Do you think there's any chance the government or an ad campaign can turn the tide on the reputation of AstraZeneca?
I don't. I think AstraZeneca's, there'll still be a few people who get AstraZeneca, and of course the people who've already got one dose, I really encourage them, of course, to get their second dose, and they're very, very unlikely to get any problems with that. And AstraZeneca is an excellent vaccine for reducing disease and risk of death and severe disease. So it's a great vaccine, but I think it's too late for AstraZeneca. We're not going to be using it in large volumes from now on.
I want to ask you about a story in the Sydney Morning Herald today. There was 3 unnamed senior New South Wales ministers who were pushing the Premier to abandon this idea of the lockdown, give up on elimination, give up on sort of suppression, and just let Delta circulate in the community. I know that's happening in some jurisdictions overseas. We know Singapore, 35% vaccinated now, will treat a COVID like the flu. At what point does Australia do that?
We're going to have to do it at some point, but I think right now is a bad time because of that issue of if we can just wait for some more vaccinations. So I think we would want to have given every person who can have the vaccine an opportunity to have that vaccine, and a proper opportunity with good communication and motivated campaigns. And furthermore, I think we'd want to have the majority of the over 70s, like 90 plus over 70s vaccinated, and 60 plus of the whole population vaccinated. That won't get us to herd immunity, but it will get us to a point where we can be really sure that the number of people dying from COVID and being hospitalised from COVID is manageable and not too severe.
Now, that is actually a very good point you make, and I don't think I've heard anybody else make it. When we're talking about at what point do we stop lockdowns and at what point do we open up, we're always talking about a whole of Australian population getting to vaccination point of 70%, 60%, whatever it might be. And what you just said then lends me to think, shouldn't we perhaps be thinking about the most vulnerable cohort, let's say over 60, over 70, that they are the number percentage-wise that actually really matters. Not so much the 22-year-old. I know they move the virus around the community, but in terms of risk of death, that's where our concentration's got to be, doesn't it?
Yeah, absolutely. So we've looked at this lots of different ways. If you're really trying to get to herd immunity, those really infectious youngsters matter a lot. But in the early days, when you sort of only half the population is vaccinated, by far the more important is getting the vulnerable, which is the older people, vaccinated first. So, yeah, I mean, our recommendation is to have this age-specific vaccination, which is what Australia is doing anyway, which is fine. But once it's really the over 70s that account for by far the majority of deaths. So they're the population to really concentrate on.
There was some modelling out by epidemiologists at University of Melbourne, very detailed modelling. You would be very confident in reading it, unlike others. They say we've got to sort of get to a number of 60%. Is that where we'll end up, do you think?
I hope we get more than 60%. So no, I mean, I think we can do better than that. Australia expressed intention a year ago of getting vaccinated in the numbers of 70 to 80%. So I think we can certainly get higher than 60%, but getting to 60%, provided it's, really heavily towards the older population, would be sufficient to reduce the burden of disease and disease and death substantially, but it wouldn't be enough to stop circulating COVID virus in the community. So we have to get used to that notion pretty soon, but not now, not yet. We've just got to hold off for a while.
Well, Professor Emma McBryde, I've listened to you do other media programs. I love that you're such a straight, plain talking expert. I'm delighted to have you on the show tonight. Thank you for your time.
So much for having me. It's a pleasure.